What's going on, everyone? Happy Saturday to everyone. Hopefully, everyone is doing well and staying safe and healthy. If you had to take a COVID test, hopefully you have tested negative. If you by chance tested positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Pandemic Update for Saturday, July 22nd, 2023. Hopefully the weather where you are is nice this weekend. We're actually having a really nice day. Temperatures just in the mid 80s, but I know that may sound warm to some. It's not if you live in the south where temperatures have been over 100. But we've actually had less humidity, so one can actually get outside and maybe perhaps at least get some fresh air. Okay, if you're new to my channel here, this is where we do the pandemic update, where we update on COVID. And some of you may be saying right now, oh, I thought that was over. Trust me, I can prove to you by the end of this video, like I do with most of my pandemic updates, that the pandemic is not over. And we'll start that out today with India, like we normally do. And India's active caseload is actually starting to increase again. We've been watching it bounce off the bottom like a fishing line when you go fishing. And today's one of those days where India is higher. The active caseload in India has increased to 1,479. It was 1,460, and they added 60 new cases. There is good news, though. Their death count did not rise today. It's still at 531,915. We'll have a little bit more proof later on that the pandemic is not over when we take a look at some other data. And actually, here's some now. The WHO has now added Omicron EG.5 to variant monitoring as global COVID makers decline further. It should be just added to variant of concern, but they're adding it to, they're at least watching it. So it's something that they're going to watch. And as you know, EG.5 is a variant that is now showing up in the United States. More proof on that in just a little bit. Taking a look at this now. 1 in 5 kids had long COVID symptoms months after infection. That's really interesting because we're seeing all these studies that are coming out saying, oh, during the COVID pandemic, which is still ongoing, we're seeing proficiency with reading, we're seeing testing scores, all this stuff in relation to school. They're not learning as well or as efficiently as they would pre-COVID. And you know what? This could be a part of the problem right here. I know people like to be quick to jump and say, oh, this virtual learning and the time that they were not in school and all it cost them so much. Okay, maybe there were a few disadvantages. Maybe they couldn't see their friends. Maybe they couldn't all eat together in the cafeteria or stuff like that. But let's also take a look at the virus itself. The virus does cause a lot of different effects that can, have a disadvantage on the quality of their education. What do I mean by that? Maybe they get distracted more. Maybe they have asthma now. Maybe they have a bunch of new things that go on in their body, health issues that disrupt them being able to get a proper education. Look what it says again. 1 in 5 kids had long COVID symptoms month after infection. And this was just posted yesterday. It says close to 1/5 of kids with COVID-19 may still have lingering symptoms months after their initial infection, new research finds. The review of 31 international studies, 31 studies, that's quite a few, found that over 16% of children and teenagers with COVID had problems such as sore throat, persistent fevers, fatigue, and muscle weakness at least 3 months later. Fatigue? So you're talking about children getting tired? How can a child get a proper education if they're constantly having fatigue, fevers, sore throats, all these different issues and probably other issues as well? So yes, this is something that is definitely a problem. And I wanted to show you this. This has to do with a tick-borne illness now. See, if you're new to the channel, we do talk about other things. It's not all COVID here on this channel or in the pandemic update. We do talk about other diseases that are going around. And one thing that I do take very, very seriously is tick-borne illnesses. You may or may not know, we have a place that I go to, up in central Pennsylvania, and ticks are a big problem. I'll be honest with you. I don't feel safe walking in the woods anymore. I mean, there are a lot of illnesses. Everyone thinks about Lyme disease, but there's other stuff out there as well. And in this case, we're going to talk about Wisconsin. And it says here, Rocky Mountain spotted fever is a rare disease that is now present in Wisconsin. And health experts say that a quarter of all cases, this is really serious, a quarter of all cases are fatal, which is higher than average compared to other tick-borne illnesses. So not only do we have to worry about Lyme disease, but now we have to worry about Rocky Mountain spotted fever because it is popping up more frequently. I was just in Maine a few weeks ago on vacation, and I was doing my research there because someone had alluded to me that where we were staying, the dog tick was the most common tick there, and they were saying, "Oh, it doesn't carry Lyme disease. It's not a big deal." Then I quickly did some research, and I found out no, dog ticks actually carry Rocky Mountain spotted fever, and Rocky Mountain spotted fever and something else. I forget what it was called. There's several different diseases with ticks that can be spread around, but it's actually starting to become prevalent in Maine. So this is concerning. I mean, these ticks are a real issue in the United States, and it's something that needs to be dealt with. All right, moving on. We have a lot more things to get to. The CDC is preparing for a winter with 3 bugs out there: COVID, flu, and RSV. Yeah, I have a problem here. CDC is preparing for this, but let's just specifically look at COVID. XBB.1.15 is a subvariant of Omicron, which CDC, we talked about this in the past here on the channel. That's the COVID variant that they're targeting with the updated vaccines that are coming for fall. However, I got a problem, and it does mention it here. It says Omicron XBB subvariants remain the most prevalent forms of COVID, though on Wednesday the World Health Organization identified a new version, the new XBB version, the EG.5, is rising in prevalence around the world. It's unclear what, if anything, the emergence of EG.5 means. The WHO noted there is no evidence that it causes more severe illness. Cohen said that so far the virus remains susceptible to COVID shots. True, but EG.5 is so young that we don't know what the percents are going to be with effectiveness against EG.5. So pay attention. It's something that we're going to be watching. Again, they're targeting XBB.1.15 this winter. And as you know, we've already moved well beyond that into other variants. And who knows? We're talking about EG.5 right now. It's still mid to late July. Winter's a long ways off yet. It's several months away. Who knows at what variant we will be talking about as we get closer to winter. Alrighty, I did a poll last night. It said, time for a poll. Have you lost friends, or maybe even a relationship with a family member over trying to keep safe from COVID? Well, 620 votes have come in. There's still 7 hours left, so that number could go higher, could go over 700. But you know what? 620, that's enough to prove a point here. 82.3% said yes. Only 17.7% said no. This did not get flooded with trolls out there who think COVID is a hoax. It's not. It didn't get flooded with trolls at all. This is a legitimate right here. 82.3% of the people who voted. And let's refresh this. Maybe it updated again. No, it didn't. Okay. 82.3% said yes. That's a real problem, my friends. That many people have lost friends, or maybe even relationships with family members, over just trying to keep safe from the virus. That is really serious. I mean, it's sad. That shouldn't happen. This is something serious. I mean, I'm hearing stories of people who have lost family members, lost friends, who have passed away of the virus, and yet they still won't take this seriously. I mean, people know people, and yet their friends just don't understand. Oh, why are you so concerned about that? It's just a mild cold. It's over with now. No, it's not. This is a serious virus that needs to be treated seriously and taken seriously. Everyone needs to have a circle of friends. I have a circle of friends. You should have a circle of friends that are COVID cautious people that you can communicate with, that you can talk to and discuss and keep each other safe and help get through this time together. I mean, as far as I'm concerned, COVID's still a pandemic. I don't know how long I'm going to be calling it a pandemic. It could be several more years. We do know this much. COVID is never going to go away, but if we take the proper steps, such as masking, air quality, we can help make our quality of life better. And one of the biggest ways to do that is to make a circle of COVID safe friends that you can communicate with online, through text message. Heck, even give them a phone call. Just call them up and say, hey, are you doing okay? How are you coping with this? Are you getting through this time okay? Do you need any support? I'm here for you. I mean, I do that with a few friends. I mean, come on. We need to be there and help each other. We do not need to be arguing and pulling away from each other. 82.3%. That's a really alarming number, and that should be concerning. That many people have lost friends, or were just trying to keep safe from a virus. Unbelievable. All right, let's move on to this. And speaking of unbelievable, here's a good reason to keep safe from this virus. Now, you're not going to hear me mention COVID initially, but I'm going to show you a link why I think it could potentially be a cause for this. Scientists diagnosed the youngest case of Alzheimer's ever reported. I know a thing or two about Alzheimer's. I was a caregiver for my grandmother, who had Alzheimer's, my father's mother. I did it for 4 years. I know a lot about Alzheimer's. It is a very real and devastating disease. It takes a lot of toll, not only on the patient, on the family members as well. I mean, it's just a very... I hope no one ever has to experience helping a family member with that, or I hope you personally never have to go through it. This person was only 19 years old, and a clinic in China diagnosed them with Alzheimer's. I mean, this is really serious. Usually, it's only people who are over 65. I mean, it can happen in younger ages, not this young. But usually, it's mainly 65 and older who get Alzheimer's. Sometimes it does happen in the 50s. Since the start of COVID pandemic, we're seeing it happen at very random to ages such as this, even as young as 19. And this person actually started experiencing memory decline. It says here, the male teenager began experiencing memory decline around age 17, and the cognitive losses only worsened over the years. This is really serious. Now, here's where I think, we don't know, it doesn't mention if he had COVID or not, but I want you to see this. This is from the American, I believe this is the Alzheimer's Association. Anywho, I want you to see this. Nearly half of patients report either poor memory or brain fog, according to a JAMA Network Open study on long COVID symptoms. And it doesn't just affect COVID patients who are sick enough to need a ventilator or hospital care. It can affect anyone who has been infected with SARS-CoV-2. I repeat, anyone who has had a case of COVID could potentially deal with Alzheimer's, whether it be directly after the case or down the line. We don't know what's going to happen several years after COVID. It's 2023. The pandemic started in 2020. We know there were a few early cases in late 2019. We don't know what the long-term effects are. Are we going to see a massive rush of Alzheimer's when people start to get to their elderly age? We just don't know that. I mean, we do know some people get Alzheimer's when they get older, but is that number going to be way up now? Is it going to happen just within the next 5 years? We don't know, and we're already starting to see it happen. I know people who work with Alzheimer's patients, and those who have had COVID see a rapid decline. It's not good at all. It's scary, to be honest. All right, last thing in the news portion. This is not good as well. I know, I'm just full of doom and gloom today, but are you convinced yet that COVID's not over? If not, guess what? Here you go. I can convince you right here that the pandemic is still ongoing. In fact, I said yesterday I would add this today because I forgot to show it yesterday. This comes from Jay Wellahan. This guy is fantastic. He does COVID modeling, and as far as I'm concerned, he has the best model out there. And model for the next 5 weeks, anticipating increases into August, driven by the EG 5.1 and FL 1.5. I don't know too much about FL 1.5, and of course XBB 116.6, which has an advantage over XBB 116 and XBB 2.3. The lack of cases for the last 4 months is expected to have increased the number of people susceptible to infection. Of course, immunity's down. And I'm going out to say this as well. He doesn't say this in the initial tweet, but not a lot of people out there are getting a booster right now. That's a real problem. So let's take a look at the graphic here. As you can see here, we're right about here right now. We're right around the end of July, and look what's going to happen into August. It's expected to increase. You can see hospital admissions, they have leveled off. Here's the model right here. It's expected to go up. Look at EG 5.1 and some of these other variants. They're all expecting an increase. XBB 116, they're having a slight increase. That's going to go down a little bit. But the biggest increase is going to be with this EG 5.1, XBB 116.6, and FL 1.5. So August, my friends, is going to be a super risky month. I also wanted to show this today. We know wastewater is rising in the Northeast, and this is not something you want to see. It actually looked a little worse earlier. I actually tweeted about it earlier. Look at this traffic here. And the specific tweet I did was the Garden State Parkway. At one point, it was up to a 43 miles. Yes, 43-mile delay southbound from North Jersey down into the beginning of the shore areas. You know, it's summertime, summer vacations, people going to the shore. Let's take a look at the southern shore points. Look at these back roads. They're just jam-packed. Take a look at Connecticut. Just a huge congestion on Interstate 95. If we go up to Maine, I mean, this is one of the busiest summer Saturdays I've seen of the year, and it actually continues beyond. And the point I'm trying to make here is cases are rising, yet we have people traveling. Some people may be asymptomatic. Some people may say, oh, it's just a summer cold, I'll be fine. Here they are moving about, people mixing and mingling in the rest areas. The tourist traps, the museums, the hotels, the boardwalks, all these places. COVID is getting spread about right now. And you just saw a model that's saying it's going to go up, and this is not going to help it whatsoever. Alright, let's run some numbers today, shall we? First off, let's take a look at Walgreens. We'll just do the national positivity. Current week, 33.7% positivity. The prior week was 32.5%. That's a difference of 1.1% up. Not good to see. Total test, 1,753. Prior week, 1,426. We know wastewater is starting to rise in all regions except that West Coast region is now dropping. That's good to see. I can't guarantee that's actually going to last because you know what? People travel across country. People get on airplanes. Planes go from the east, they go to the west, back to the east. You know, people spread all around. And we know the percents of these variants are going to go up. Let's continue on to this. We will have our wastewater update tomorrow, but let's take a look at this anyhow. New sites, 164. 0 to 19% COVID detected, 556. 20 to 39% COVID detected is at 394. 40 to 59% COVID detected is at 160. 60 to 79% COVID detected is at 45. 80 to 100% COVID detected is at 5. So that's today's little wastewater update. We'll have a full wastewater update tomorrow. And let's take a look at this. XBB 116, the original XBB 116, is at 14.8%. XBB 191 is at 13.2%. XBB 2.3 is at 13%. XBB 1.5, you know, the variant from last winter, is at 12.3%. And EG.5 is at 11.4%. And XBB 116.6 is at 9.3%. And finally, we'll end on XBB 116.1, which is at 8%. Let's take a look at emergency department visits for COVID, and we can see here the majority of the states are either stable, rising slightly, or substantially rising. There are only 4 places that did not report data: Puerto Rico, Oklahoma, Missouri, and Minnesota. Even D.C., District of Columbia, is stable at this time, which We would like to see more places dropping. The only states that are dropping are Vermont, Delaware, West Virginia, Arkansas, Nebraska, South Dakota, and Wyoming. So not good to see that many states either stable or rising. I mean, while stable's not a bad thing, could also signal that they could start rising soon. Could also signal, let's be optimistic, could also signal maybe they're going to drop soon. All right, this day in COVID history, July 22nd of 2020, the Department of Defense and HHS reach a deal with Pfizer BioNTech for the delivery and distribution of 100 million doses of the Pfizer BioNTech COVID-19 vaccine candidate in December 2020. Upon confirmation that the vaccine is safe and effective, we know it was, antibody data examined by CDC shows that there were about 10 times more SARS-CoV-2 infections than first reported in March 2020 through May 2020. Depending on the region, there were 6 to 24 times more cases than initially reported. And as we recall, testing was very hard to get at the beginning of the pandemic, and testing now is an issue, and we know either some people just don't want to get tested, or they have to pay for a test, and they're just not going to do it. There's many different reasons now that, up to this day, testing is now a big problem. We're not going to take a look at any of these wastewater sites that show the other data. We'll take a look at that tomorrow. Let's move on to New Jersey because we've already gone 21 minutes here. Hospitalizations in New Jersey, 181. 6 people in a ventilator. The ICUs, 16 people in the ICU. And discharges are at 24 today. 69 out of 70 hospitals reported in New Jersey. Now for Philadelphia. Let's cross the river into Pennsylvania. Take a look at Philadelphia. There were 807 EMS incidents yesterday, and that's still at a concerning level. And the weather is actually getting better now. I hope to see this number drop over the weekend because we're not seeing the high humidity. When we saw the high humidity and heat, which it's coming back next week, but when we see it, we see really high numbers of EMS calls. If that doesn't drop this weekend, that's truly concerning. And let's do a live look at what's going on in Montgomery County. And wow, I don't like what I'm seeing here. Cardiac arrest, respiratory emergency, cardiac emergency, respiratory emergency, another cardiac arrest, dehydration. Now see, dehydration, that could be many things. That could be heat related, or that could also be, COVID related or flu related. That can cause you to get dehydrated. Seizures, that's happening. So we do have some things going on there. What's going on right now in Chester County? Just a few calls, but they're not good ones. Respiratory, sick person, heart problems, unresponsive, and back pain. And I can tell you this much. I had Center County on earlier today. That's where Penn State University is, and State College, and there's also a rural setting as well. And it was very busy there. I was hearing a lot of respiratory breathing difficulty calls. They call it breathing difficulty on the dispatches. So I'm not like hearing that. And my concern is that could be COVID related because, a lot of people not getting tested, and COVID can cause respiratory issues. Let's take a look at New York State, and then I'll move myself back to the right, and we'll be done for the day. Taking a look here, 441 cases in New York State reported yesterday. They don't update over the weekend. 7.9% positivity, which is higher than the 7-day average of 7.4%. Taking a look at New York State hospitalizations as this refreshes, and I'm going to zoom this in to make it easier for you to see. You can see New York State hospitalizations, they have been starting their rise. 447 people in hospital, 56 people in the ICU, and in New York City, as you can see here, 201 people in the hospital, 26 people in the ICU. Alrighty, that's all I have for you today. Tomorrow we'll go a little deeper into the international update. I'll bring up some of those international variant charts tomorrow that I like to look at, that graphic from Our World in Data. I'm sure it has updated since the last time we've taken a look at it. It's been quite some time. Later on today, we're going to have the staffing shortage video. We do that about once a month. We haven't done, it's been over a month since we've done one, and trust me, I am going to do a 10-minute video. I'm going to keep it at 10 minutes, and wait till you see how many things I get within a 10-minute video of sectors that need help, that need staffing help. Alrighty, folks, that does it for today's pandemic update. We'll have another pandemic update again tomorrow, staffing shortage later on, and also the full wastewater video again tomorrow. If you like this video, give it a thumbs up. If you want to see more content like this, hit that subscribe button down below. If you are convinced that the pandemic is not over, by all means, spread that message with your friends, family, whoever else needs to know that the pandemic is still real and it's still ongoing. By all means, share it with them. And until I see you all again next time, stay safe, everyone. Thanks for watching.